Hi, I'm Grace.
I'm Jess.
And this is Scrubs Anonymous. Okay. Hi, I'm Grace.
I'm Jessica.
And we are going to do a few YouTube videos for our project in nursing school talking about chronic diseases. We are in Adult Health 1 right now, which is the first med-surg class. And so we're going to be doing some videos on different chronic diseases, just explaining key things to know about them, how to identify them in a patient, nursing interventions, just things like that, that hopefully can help you in nursing school. And this is something that we're doing for nursing school, just a project. So, yeah.
Okay, so the first thing is about Parkinson's is that it is decreased dopamine in the brain. So, do decreased dopamine. And this is what causes all the symptoms of Parkinson's. So,
And then something to remember with that is that one of the medicines used, an anti-Parkinsonian drug, is levodopa, and you can remember that because of the dope in dopamine, which is the reason that Parkinson's is happening. It's a chronic progressive neurodegenerative disease.
And we'll go into the signs and symptoms. So, okay. So one of the first signs and symptoms, and one of the main ones that you'll see, is the shuffling gait. Another one is the pill rolling with the hands, so it looks like they're rolling pills in the hands.
So they often have a stoop posture and they're shuffling and moving their hands. It affects your motor cells. So.
Yep. Yep, so stooped posture. Okay. They also have lack of balance. So if you do a test where you pull them back, they won't be able to catch themselves.
There's also loss of automatic functions, so things like blinking and facial expressions and swallowing saliva can all be impaired.
So you'll see some of them they'll be drooling, and with blinking they'll not blink as much. So it's called the stare of Parkinson's. So it just looks like they're staring and emotionless. So.
And then just so you know, some non-motor, they can have depression because of the chronic disease or as a result of it, drowsiness and short-term memory loss, and fatigue. So men and increased age are risk factors. I'm not sure if that's in your... Oh, it is. It's right in there. Good job.
Oh, it is.
It's like right on the edge. It's perfect. Like that, that's the line.
And increased age.
Yeah. Risk factors.
Okay. And then 15%.
History. So now we will go into, and I will describe the disease, we'll go into explaining interventions and implications for nursing. This part will be like fast forward. Hi, the nursing, the implications for you as a nurse.
Okay, so a couple things you want to assess is their mobility and their balance. So that could be a fall risk. So you want to do mobility.
And that again is pulling them back to see if they have stability.
Yes. Another thing that you'd want to assess is their aspiration risk. So you want to see how they do with thin liquids. So you want to do a thin liquid aspiration test. Okay, and then
For diagnoses, they could be at risk for aspirations, they could be impaired mobility. That would be a big one for Parkinson's. And something that you can improve their quality of life will come in the implementation, but what's another one? Impaired mobility, aspiration risk,
fall risk.
fall risk. And then planning and implementation would be the administration of anti-Parkinsonian drugs and just improving their quality of life. Exercise is a big thing with Parkinson's. The more that they exercise, the more their movement is improved with exercising, and they can do more things if they maintain that lifestyle.
You also want to educate on lifting up their feet when they walk to decrease the fall risk, and removing obstacles in their home that may be a fall risk as well, such as throw rugs or and putting like a shower mat in the shower.
And an elevated toilet seat, potentially. And then diet is another instructional, so you want them to take smaller and more frequent meals because they have this risk of aspirating. You want them to get the nutrition that they need, but taking smaller meals and eating slowly, giving yourself enough time to eat. These are all things that you can teach your patient who has Parkinson's.
Oh, yes, so softer foods.
Softer foods.
Thickened liquids. Okay.
And then you're going to be evaluating just for the effectiveness of this. So if they're exercising regularly, how that's improving their motor skills. If they've had any falls, you're going to be evaluating the effect and how frequent their falls are. And if they understand, if they can repeat back to you the things that you've taught them, and they understand the diet and the way to walk and things like that, just to improve their quality of life, because it is a degenerative disease and you're not going to be curing them of Parkinson's by giving them medicine or anything like that.
also, you want to make sure they're adhering to their medicinal regimen in order to maintain or keep the Parkinson's under control, to reduce some of those symptoms.
And if they're missing doses, if they need a family member to help them, or some kind of system in place to make sure that they understand how that will affect them if they don't, and that they're not taking them too much or too little or anything like that. So that is the basics of Parkinson's disease. Just a few things to remember. There's obviously lots more out there, but hopefully that will help you just get the basics of what Parkinson's is and how you deal with it as a nurse. Thanks for watching. My mom and like 2 other people watching it. Her mom. My mom. Maybe our teacher.
Definitely sending it to mom.
Okay. All right, we're gonna be playing a fun game of tic-tac-toe. I still can't think of it. Hangman. And then, yeah, every video we're going to be doing one fun thing. Next video, Jess will be sharing a personal story.
From deep down my heart.
Deep. I'm not even going to be in the room. Just you. Okay. Okay, for real, we're going to do this. Okay. A. I'm going to guess A. C. I'm sure that you've all heard about Nightingale, so I will spare you the details, but that's a nursing fact. Yep. Yay, Grace! Got it! Thanks for watching. See you next week, next month. Wait, I'll have my stethoscope on. I'll be like, oh yeah. Ready? Signing out. Like that. Yeah, good. I like it.